Good afternoon, ladies and gentlemen. I would like to thank NASCOM for this opportunity to speak with all of you. As Dr. Ganapathy and Dr. Kim have so clearly, with figures and with all detail, described to you what telemedicine is all about, let me now take you the next step. We all know that telemedicine is something which is extremely important. It is a way of reaching out to patients who are sitting in the villages who would otherwise have died, perhaps. I mean, I'm using very strong words, but then the idea is that people who can be treated through this kind of IT mechanism, and it would make a great difference to the lives of many, not just in India, all over the world. We all already know what telemedicine is, thanks to Dr. Ganapathy's very eloquent speech. Let me now go the next step. We need telemedicine, but what is the issue? Why are we not getting telemedicine? Basically, we know that telemedicine is helping patients all over the world because of the cost of Medicare spiraling upwards, shortage of doctors means in villages, low availability of specialist services. He's given you the figures in the rural environment, skewed distribution. That's a terrible thing. There is inaccessibility. This telemedicine ensures that there is cost effectiveness. A person who might spend thousands of rupees trying to come to the cities for treatment can now get treatment sitting in his village. It saves a lot of money. It obviously improves quality of care. It improves quality of services. A doctor who sits in a village, practices telemedicine, keeps learning from the specialist and is able to hence improve his quality of services. He learns. That's the reason we say that doctors are always practicing. They're never perfect. It obviously lowers morbidity and mortality. Now, going further, let me just give you an excerpt from a speech by a President of India. What he's talked about is setting up of 30,000 static telemedicine stations distributed in 30,000 key locations with a zone of 3 lakh villages and so on and so forth. It's all given there. I'm sure many of you must have heard about it or read it. But what I'm trying to say is the numbers are huge. The numbers are huge. Dr. Ganapathy talked about 200 plus telemedicine centers, but let me tell you, if you expand the description of the word telemedicine, we actually might have about 500 to 600 centers in India, but that's not enough at all. And let me tell you, we have these so-called 500 centers plus, and everybody's doing it. The government is doing it, private, corporate, and even NGOs are doing it. Almost everybody's doing it. Incidentally, I'm from Axis, which is a UK-based company, and we provide electronic medical records. But in spite of all this, what do we have with us? Just about 500 plus centers when we need much, much, much more. Why is that? In the past 6 years, we've increased our numbers just by from say about 100 to say 500. Why is that in a country of our kind? Who takes ownership for this? Is it the government? Is it the corporate sector? Is it the unorganized sector? Who? What about the NGOs? Everybody seems to have a finger in the pie. In spite of that, it's not coming up. Telemedicine is not coming up in the villages the way it should come up. And the reasons are many. Let me tell you about the talked about barriers. We talk about complex implementations, improper selection of telemedicine centers, high costs of equipment and infrastructure, high costs of maintenance, high training costs, complex training requirements, lack of connectivity or poor connectivity, inconsistent services even by specialist service providers. But these are just the talked about barriers which are preventing telemedicine from going right across the country. Let me be honest with all of you. What is the real barrier? What is it? What is in it for me? Regrettably, that is the real barrier. We cannot have any kind of service expanding and going from end to end unless there is something. It is a win-win. Let it be a win at least. And that's where the problem is. We come out here, we are talking about that beautiful global CSR. We are talking about CSR, we are talking about being very responsible, corporate responsibility and things like that. Yes, people are putting in a lot of effort. But how much can corporate responsibility help? I mean, okay, you set up 10 centers, 20 centers, 30 centers, but do you know what the real number is? Are you aware of what we really require? Let's move a little further. Let's have a look at this fact. Uh, we are supposed to have about 23,000 or so PHCs. And as you can see the numbers, if I just take all these numbers and rather than confusing you, put it together, we need a minimum of 115,000 centers, 1,15,000 centers at least. And this is an understatement. I have not really gone into the nitty-gritty. The number could easily be double of this. And now, please tell me, where is 500 and where is this number, which could go as high as 3 lakhs? Yes, ladies and gentlemen, this is what we need. And this is what we do not have. And that's where things have to go a little more responsive. So let's start looking at real solutions rather than saying, sorry, I'm very happy. My conscience is clear. I've done what I'm supposed to do. I've done my responsibility. My corporate arm has done its responsibility. Let's start actually looking at trying to do something which gets the bacon home. Okay, first, we're not asking the government to keep doling out money. I mean, I don't believe in the fact that you got to, give a guy fish every day. You got to teach him to fish and go beyond that. I had a very interesting gentleman who said, let's go beyond that and teach him how to take that fish and sell it in the market so he can make more money for himself. In other words, let the government support. Like, for example, when I want to get some very important equipment for telemedicine, which is literally life-saving, I have to pay huge amounts of taxes. Why? Why? Let the government help us. Give us subsidies. Give us support in this kind of way. Let there be a public-private partnership. Let us work together with the government. Let the government give us support. We will work. We means, obviously, the corporate sector, the private sector, and let's get everything working together. But what is most important is let's have a self-sustaining business plan. Let's talk about getting this business running on its own. Let's have entrepreneurs sorry, I think I pressed the wrong button. Let's have entrepreneurs getting into the picture. Let them find a way to make money out of this. Let us, of course, take all the help possible, but what is most important is we need to have a sustainable business model which would automatically, whether we like it or not, greed will drive it. Because every man out there sees a chance to earn money. And he is going to come out with telemedicine centers. Thanks to good connectivity now, thanks to support from the government that way, here is a huge opening. Just work out with sustainable business plans, and I assure you we can easily hit this target of 1 lakh plus, and the plans are there. There are enough hospitals which are trying out plans which do work, but please remember these plans are very specific. It's like a patient. I, as a doctor, when I see a patient, that patient is very specific. I mean, I can't give him a general solution. Similarly, we got to give tailor-made solutions, but these solutions are there. So, ladies and gentlemen, let's start looking at this, and that is how we can actually go in for the number of centers that our country really needs. Thank you.